Good morning, I'm Larry Seidling with LCTV, and today I'm at Lincoln Academy as we are going to bring you a health update on this COVID-19 pandemic, as we've been doing right along, but we're going to do things a little special today. My guests today are Eric Duffy, the Director of Health Services here at Lincoln Academy, and Dr. Andrew Russ, Vice President of Medical Affairs for Lincoln Health. Gentlemen, thank you for taking a few minutes, and on a gorgeous day,
Absolutely.
We're outside, can't beat it. First question for you, Dr. Russ. Can you give me a quick update on the COVID-19 in Lincoln County? And also, in particular, what about the outbreak they had at McDonald Valley? What do you know about that?
Well, thank you, Larry. Thanks for having us. And I think it's great to be here at Lincoln Academy. It's sort of, we'll talk about this, but it emphasizes the partnerships that we have in the community, so that's great. We do have a partnership with Madomic Valley High School as well, and RSU 40. We're following their cases pretty carefully. And the school, Madomic Valley School System, has done a great job of responding to a growing number of cases over there. As folks probably know, the CDC is a little bit overwhelmed in their response to various cases, and so Madomic has had to operate without a full set of information, but they're responding on a case-by-case basis, and as you know, the high school is fully remote at this point. It's just an indication that this has the potential to affect any of us. One case can quickly become 5 cases, could become 25 if we're not careful. The rates in the county have ticked up slightly, although our case positivity rate at Lincoln Health is still about 1%. So that means 1% of the people we're testing are positive or have been in the past week. And that's good news. That's not much higher than it's been for the past couple of months.
Eric Duffy, Director of Health Services, Lincoln Academy. How things going at Lincoln here as far as the sessions and the protocol and what you all got going on? A big challenge.
Yeah, sure. You know, we were joking in the first week of September that this is the 219 times Lincoln Academy has opened on the top of this hill, and this must be among the most unique openings of school we've ever had. So we started planning in March. We knew that every time there was a case in Lincoln County, we wouldn't be able to shut down our school the way we did when the pandemic first made itself known. And we began with going through the entire facility, looking at spacing and ventilation and getting advanced orders of PPE in, and a number of things along those lines. And then we did research really through May and into June. And by June, we had a working plan of how we could open up. We knew we couldn't be full strength. We can't have 500 students in these old buildings and be able to offer any distancing. And so we've come in at a half model, 2 cohorts that come in for 2 days a week each. And it's so far so good. It's worked out pretty well. It's extremely different. For a teacher, you're trying to fit the square peg of your curriculum into the round hole of synchronous and asynchronous learning and limited time with a student. And for students, it's a challenge if you benefit from having the extra support or direction in your work, to have to be more self-reliant, have everything online. It's a learning process for everybody.
I understand that Lincoln Health and Lincoln Academy have had a long-standing relationship pre-COVID.
Right.
For a school-based health clinic. Can you talk a little bit about how that all works?
Sure. We're extremely fortunate. We're benefiting from the heritage that was first brought in here by Dr. Fader and others in the mid-90s. There was a grant program in Maine that established about 15 school-based health centers throughout the state with the goal of bringing primary care closer to rural and underserved teen populations. And we started with that, and then Lincoln Health, as the grant went away, Lincoln Health just sort of took that on and has provided for us here usually a nurse practitioner 3 times a week on site, and then a medical director in the form of Dr. Russ, who I can call and ask questions and whatnot. And so a student comes into the health center, they see me, and I'm sort of the gatekeeper, and I do the triage, and I decide whether or not this is something that we can handle here, or can we have an appointment with the PCP. Right now we're working with Jennifer Wright, who is a nurse practitioner in the Wiscasset practice at Lincoln Medical Partners. And it's great. We have a part-time social worker from Lincoln Health as well who sees students here, and we now are all set up on telehealth where we can do remote visits also.
Dr. Russ, are there any other school-based health clinics in Lincoln County? I suspect they're probably pretty helpful to the primary care providers such as yourself.
Yep. There's been one in the booth-based school system for a number of years, similar to the one here at Lincoln Academy. In the past year and a half, we've been building our resources at Madomic High School. That's been sort of slow to take shape, but some of that has to do with the fact that we're in the middle of a pandemic right now. So we've had a social worker at that school for a year, and we do have a nurse practitioner ready to be deployed this year when they're able to go back in person. We also have a relationship with Chewonki School in Wiscasset, and so every school, every community has a different set of needs. Here at Lincoln Academy, we have the international students who live here. So for all intents and purposes, the school serves as their parents while they are here on campus. And so they have an extra level of need perhaps for the school-based health center support that someone who is just, so a day student in Booth Bay, for example, those patients can, or those students can go home to their families and get medical care through their primary care office. For those students who are coming from all over the world, they need a medical home when they're here in Lincoln County.
Certainly a different set of situations or circumstances for these foreign exchange students.
Yeah, absolutely.
And yet what it also does for our day students is give them a chance to come and talk to a healthcare provider without having to worry about their parents or their guardians or their siblings or how much time they have. When a student comes into the health center and speaks with a registered nurse, it's completely confidential unless there is imminent risk of harm that I'm worried about in that person. So they can come in and ask anything, and they can talk about anything, and they can have confidential conversations about subjects that they may feel uncomfortable, that may be barriers in their home or their own anxiety to getting help. And I think that's where we see a big part of our work with the day students.
Dr. Russ, has Lincoln Health been advising schools like Lincoln Academy during the COVID-19, or even the grade schools? What were you doing, or were you doing anything like this before the pandemic?
So we have had medical advisor relationships with most of the local schools for years. A school has to have a medical advisor. And in the past, that medical advisor might have answered 1 or 2 phone calls in a year, right? We have an outbreak of lice. What are we going to do about that? Or there's a kid who went home with chickenpox. What do we do about that? This year, the demands on those medical advisory relationships have clearly blown up exponentially. And so one of the things that we've done is we've tried to put together a team of people so that it doesn't just have to be me answering questions. We have a great team of people who have access to the answers, or at least know where to get answers to questions that come from the various schools, whether it's elementary school, daycares, preschools, high schools, the camp, Chewonki, for example. So it's a relationship, or it's a series of relationships that's been in existence for a long time, but this year has just strengthened those relationships.
Mr. Eric, I'd like both of you to talk. What are the biggest challenges being faced by schools during this pandemic? Let's start with you.
The same challenges that any subset of our community is facing. COVID fatigue.
I think we all have that.
Generalized anxiety, hypervigilance, or on one extreme, or frustration on the other end, where we won't engage with the various safety protocols that have been established. And so I worry about misinformation when I'm talking with students about what they may be hearing or believing or understanding about it. But I think that here's one of the things that I found the hardest. I transitioned here from emergency nursing and working in an ambulance, where there's immediate gratification for your interventions. School nursing is more of a process. You need to give the young person a chance to mature and to unfold and offer what advice that you can. To me, and it's analogous now that we're trying to have these safety protocols, but there's no obvious gratification. There's nothing obvious that we're doing except positivity rates and things that can be a little bit more esoteric for people. And I think so many folks have given up so much in their personal lives and their professional lives, but their personal lives especially, that the frustration of all of it. When you can't see a microbe, it's hard to say that this is making a big difference. But it's trusting the science, and trusting the fact that understanding that all of these decisions are based on incomplete information. But we're working hard to make decisions that are not going to be based on inaccurate information. And sometimes that perception in the community can be challenging. But our parents have been great, our students have been great. I can honestly say I have not sent a student home with suspicious symptoms from Lincoln Academy this year. Right.
There's some gratification.
Yes,
right
sir. That was gratification, and if we hit Thanksgiving, then that will be some gratification as
Just
well.
a couple more weeks to go.
One day at a time, but we're also only one case away at any given time.
Exactly. Dr. Rush, can you talk a little bit more about formalizing relationships that are being developed moving forward with Lincoln Health in the area schools?
Yeah, well, we do. I mean, I don't know if this will be exciting for your viewers, but the language matters, right? Whose responsibility is this particular set of what we're doing?
Chain of command, so to speak.
Chain of command, right? Knowing who to talk to, knowing what you can expect in terms of services from the healthcare community and vice versa, from a school nurse or from the director of health services. We can't be all things to all people, and we're sort of operating in not a public health vacuum. I think the CDC has risen to the challenge, but they don't have deep resources. And so we, as a healthcare system, together with the schools, are largely trying to be a public health resource for the community in the absence of boots on the ground, people who can do vigorous contact tracing. So, language matters, and making sure that we are accountable to each other, putting that in writing, all those things are important, so that if something were to happen to Eric or something were to happen to me, our teammates, our teams can step in and get the job done.
It truly is a team effort to control this. Mr. Duffy, as the community spread expands across Maine, what steps are the students, faculty, and staff taking here at Lincoln Academy to minimize that risk?
Yeah, we, as I alluded to earlier, we came in with the attitude of, if we come in low and slow and the numbers go up, then we're maintaining a safe school community, doing what we do best for as long as we can do it. And if we come in low and slow and the numbers stay the same, then we're doing our part to keep the curve flat in Lincoln County. And if we come in low and slow and those numbers drop, then we can't wait to take these things off. Right? And so we've taken a pretty conservative approach from the start. We send out a health pre-screening every single day to all faculty and staff and to all students for the days that we're expecting them to be there, asking them the typical COVID screening questions.
Is that done electronically?
It can be done electronically, but we actually even offer you a paper option, which is unusual.
What a rare thing in this day,
rare thing
this
nowadays,
environment.
And so we can hand a student a stack of them. They can take it home, and we ask that parents do it, but in the place of parental involvement with that, then we can accept that from the student, or we'll even just take their temperature. So students come in only two places, one right here in the loop or in the parking lot. They're met by administrators who have hand sanitizer and are asking them in a roster, have you done your health pre-screening? No, you're not sure? Hey, here's the card. Or if the student appears symptomatic, head to the health center right away. They're provided masks and all of that, and that's just to get through the door. And from there we have 10-minute passing periods. I was just saying to Dr. Russ, compared to in years gone by, it was like the running of the bulls at the changing of the bell. And now at a half population, it's very manageable. Students can space from one another. Meals are delivered directly to classrooms. That our dining commons staff is phenomenal. They have reusable tiffin boxes, stainless steel boxes, that they bring meals directly to all the students. Hand sanitizers have been established everywhere. We're doing a major renovation project in the gymnasium and establishing a new air filtration system, but not just in the gym, it's actually going into classrooms and wings and whatnot. So a real update of our HVAC. We're having windows are open, all the rooms have fans. Our maximum capacity in a classroom is about somewhere between 10 and 12, depending on the space. And then after that, they talk about the Swiss cheese, they talk about the layers, and then from there we just try to do our best with it. But the parents have been really collaborative. The students have been great, if frustrated, because even in our sports programs, we made them train masked. We took a more conservative approach to that than than the MPA guidelines or even some of our peer schools. And that was frustrating for our athletes in places. But our trainer, our head of school, and others would go down and sit with the athletes, answer their questions, talk about the reasons why we want to do these things. And we've had close calls, and we're finding that the cases are coming closer to us. You know, first-degree family members or students being tested or those kinds of things. But so far, we're, as I said, day by day.
Have you had to do extra training with your faculty? I mean, a social study teaches social studies and might do a study hall, for example. Now are they being asked to take temperatures? And
No, and that's a fine line too as to what we can ask people to take on as a new set of expertise. You know, teachers' jobs a teacher's job is to teach, and the context within which they must teach this year, partly online, synchronous, partly online, asynchronous, and in person, the work for teachers has gone up, I think it's safe to say, almost exponentially in ways. So no, what we've done is we've done additional amounts of training in our start of year sessions, that in the same way that we did bloodborne pathogens and allergies and sexual harassment and all of the required. We added on almost a half a day where we had teachers changing classes under COVID precautions. And we had them move through the building and see what it was like to actually keep 6 feet, 2 meters. You know, how many kids do actually fit in here? You know, now that we put 12 people in here, it can't take 12 people. We're gonna have to go to 10. So, and then that has ripple out effects. But our head of school, Jeff Burrows, assembled a strong team, and he started us early. And what a lot of the data coming back from all over the world is that the schools that have stayed open the longest are the ones who were consistent in their precautions and took the most cautious approach early. And I feel that with Dr. Russ's support and Lincoln Health's guidance, we were doing pretty well so far.
so, Dr. Russ, I know we're at Lincoln Academy today, but can you talk a little bit about the efforts going on at other area schools, how things are going, and how much training have you had to offer or put out there for these other schools to maintain the same level like we're doing here at Lincoln Academy?
Yeah, well, interestingly, I mean, the schools are each responsible for creating their own plans, right? And that's sort of under the auspices of the Department of Education and the guidance that they get from the DOE. We are in more of an advisory role, so we certainly didn't develop a plan for Lincoln Academy. Lincoln Academy came up with their own multifaceted, robust plan that you just heard about. Booth Bay has its own plan. Madomic, the RSU 40 schools have their own plan. And they're all done within the guidelines, but some people take those guidelines and go to sort of the more cautious extreme of the guidelines, and other schools have been, I'll just say, a little bit less cautious in terms of interpreting the guidelines. We have made sure that people follow the guidelines, and if there's something that we feel is absolutely unsafe, we will say so. And again, in terms of sort of education, there is nobody who's a COVID expert. So we just I do my best to stay on top of what's coming out of the state CDC. I stay on top of what's going on from the Maine School Nurses Alliance. And we have people working for Lincoln Health who are responsible for sort of constantly monitoring what's going on in terms of resources in our community. Because no one person certainly can keep up with all of the changes. And what I say right now may be obsolete by the time you go on air, right? So that's how fast moving this can be. So I think more than anything, having the lines of communication open, making sure that people know who their resources are, and making sure that we have regular check-ins with all of the schools, from nurse to nurse or principal to principal, superintendent to superintendent, with health system support if they need, has really been the biggest sort of benefit of coming together as a group to respond.
Dr. Russ, what communication do you have with the CDC on a regular basis, daily basis?
We don't have, so people seem to think that we have the secret back channels to the CDC, and we
You don't have a hotline to them?
No, I have a couple of numbers that I like to call on occasion, but I like to not use those resources up. We get information through our connection with Maine Health. So we have good resources from Maine Health, speaking daily, multiple times a day with experts from the CDC. And then we have local case managers, typically nurses or other case trackers who are responsible for responding to an outbreak or even to an individual case. And we have some communication with them, but it's a work in progress. They're busy, we're busy, everyone's trying to get the information as quickly as we can and make sure that that information is factual, accurate. And then we spend some time dealing with inaccurate information that gets out through social media. We spend a lot of time actually responding to that on the phone to families who call in and say, I heard that there were 2 cases at Lincoln Academy a month ago. And I so quickly called Eric and we put our heads together and realized that that was fake news and tried to get out the message that that's not true, but we're continuing to pay attention. So to answer your question, Larry, we don't have a direct contact with the CDC, but we certainly have good relationships.
If I could add on to one of the things that Dr. Russ was saying before to your previous question, as a registered nurse, it's part of my job, and the nature of the job is to kind of have one foot on the shore and one foot on the boat, right? I'm somewhere between the patient and the doctor, and I need to be able to explain things clearly in either direction. And one of the things that Lincoln Health has supported that has been hugely helpful for me is we started a nursing Zoom group where all of the AOS nurses get together every week, and we started this in May, April, even before people were fully done with their school years. And it allows all of us in very different settings. South Bristol School is different than Jefferson, than Lincoln, than GSB, but what it does was give the nurses a chance to talk shop every week. And now we've had, over the past 2 months, a chance to have that same kind of Zoom format, but it's office hours with our medical directors. And so we have Dr. Duchesne and Dr. Russ on there, and we can ask all kinds of questions. And that's really helpful, because as a school nurse, you're out here making clinical decisions sort of on your own, and you don't want to run everything by your provider. But to have a chance to do that, I think those were very, had a lot of impact, adding those components on to support the local nurses. It was excellent to support the schools in that way.
Well, gentlemen, this has been great. Is there anything else, Dr. Russ, you'd like to add to this?
I want to applaud Lincoln Academy, Eric, and the team for doing a great job. I will add that in our community, people hear about community transmission and what that means. And of the people we test at Lincoln Health, we have a pretty good sense so far of where each of those people contracted the disease. We hear from other communities that many people are coming into their testing facilities who are positive, and they have no idea where they got it. That's concerning to me, right? And so I think we're not in a bubble by any stretch, right? But we still have a good sort of grasp on what the extent of the disease is in our community, and we hope to keep it that way. Thanksgiving holidays are coming up, and I should probably take this opportunity to echo what others have said, is that you would be probably best served by altering your plans or keeping your plans small, keeping them local, keeping them to people who you already have contact with, because I worry that as much as we all want to spend time with our families, if we start mixing, especially if we start mixing from a geographic standpoint, the lid is going to come off, and we don't want that to happen.
And Mr. Duffy, your closing thoughts.
This is a great community, and I've had a chance to practice emergency care and frontline medicine for 20 years here. And this is one of those situations where we truly all need to think about being in this together. I don't care what sign is at the end of your driveway for the last week. I don't care what your views are or anything else like that. This is a real thing. But it's a microbe. It's hard to see, hard to understand it sometimes. And so I guess I'm just imploring folks to find the courage, find the stamina, take a mask break, and we don't know when this will start to come down. And we've been lucky for a long time, and we've been diligent, and we have tremendous support, but we can't give up yet.
Gentlemen, thank you very much for taking this time. Eric Duffy, who is the Director of Health Services here at Lincoln Academy, and Dr. Andrew Russ, who is the Vice President of Medical Affairs here at Lincoln for Lincoln Health. Larry Seidlinger for LCTV. Today we've been at Lincoln Academy up on Academy Hill here, bringing you an update and a little different story than we've been doing on these pandemic updates, maybe a little more in-depth at the high school level and the school level of what this all means. So we thank you for watching. Join us next time on LCTV as we bring you these COVID-19 updates. Thank you for watching.